This is OHSU, shaped by leaders, pioneers, and those brave enough to take that first step. We carry the torch and shine a light on what is possible. We are a collaboration of disciplines, listening to one another, learning from each other. The OHSU Anesthesiology and Perioperative Medicine Residency Program is more than an opportunity to gain experience. It's your time to serve with a community of trailblazers and groundbreakers.
The thing that helps us stand apart from others is our supportive and teamwork-oriented approach. We have a very collegial and friendly working environment. We have great relationships with our surgical colleagues, the nursing colleagues. Ever since I started here in 2014, I felt that that teamwork approach was much more front and center here than other places that I've experienced.
The ACGME regulates every program, and so every program has to teach you anesthesiology. And so finding your people is probably the more important thing, because you're going to be living there. You're going to be a resident.
One of my questions to one of the attendings here was like, what is your quality of life? Like, I can get great training at a lot of different places. What makes OHSU different in terms of being happy? And he was telling me about their flexibility, in terms of how he sets up his schedule, both clinically and research-wise. And it was something that I had never heard of before. And he's like, yeah, this is one of the things that we take pride in, is being flexible, making sure that we can accommodate people who have families or people who have, other constraints, making sure that they want to be here.
The case that I'm in right now is actually a plastic surgery case. It is a patient who has had breast cancer and is undergoing breast reconstruction surgery. My role as an anesthesiologist is to be with the patient throughout the entire case, letting them know what the expectations are going to be, making sure that all of their vital signs are stable, from heart rate, blood pressure, their oxygenation, making sure that the vent is working, making sure that we can titrate all of the settings. Pain control is another big part of it.
I'm over at the VA right now, and so the team is comprised of doctors, nurses, social workers, psychologists, a ton of people to sort of help patients through what we call serious illness. So it doesn't have to be end of life or hospice or anything like that. It can just be a big diagnosis that is hard to deal with. And so we try to help with symptom management, pain management, existential management. We have chaplains who are part of the team too. And so just getting to know patients and trying to figure out how to help them through a big event in their life is really our role.
A resident coming to this program is going to get an excellent clinical education. They're going to leave this program having seen more than they really need to see of all of the different types of cases that are out there. Most of our training happens here at OHSU, but residents will go to different locations as well. They're all nearby here in Portland, but across the bridge to Dornbecker Children's Hospital, across a different bridge to the VA hospital. We have a private practice experience with some of our, one of the Kaiser facilities. So through that, residents will get a broad range of experience in different locations in addition to the different types of cases.
When I was applying to programs, there was certain categories that I felt like I needed to meet, and OHSU, one by one, just kept checking every single one of them. I wanted to be surrounded by people that were, one, going to be helping me, two, supporting me in any way possible, and three, just wanted nice people, all around to just help me grow as a clinician. And yeah, I really do feel like OHSU has met all of those expectations.
Before this, I was a biomedical engineer, so I worked in orthopedic spine, designing instruments for a couple of years. And then I did a PhD in stem cell and cancer biology, and then I came here and I'm in the research track. But there are people who came here who were pilots, and they're, flying, fighter planes for years. There are people who were whitewater raft instructors or ski instructors. There are people here who were social workers. So I feel like there's a whole spectrum of life that is brought into the program aside from being a clinician or being a researcher. I think that makes it fun. It makes it really interesting.
At some point, it's about the why you do what you do, as much as the how. We do it because we are bold. We do it because someone needs to make the difference, and we know we can make the difference because we already have. We welcome the curious, inspired, and those willing to be bold. This is OHSU.